In some of the work that we've done in evaluating where some of our programmatic gaps are and in discussing some of the ways that other cancer centers are operating their multidisciplinary pancreas cancer groups, we realized that there was a gap in a navigator role, so to speak, within our program. Unfortunately, due to COVID and the hospitals being under some financial constraint right now, we do not have the bandwidth to hire another FTE in order to fill that navigator role. However, in discussing this problem with the Learning Network, we realized that we didn't have to just wait until COVID ended and we had the resources to hire this person. Instead, what we decided to do is have one of our nurse practitioners actually pilot a rapid visit intake within 24 hours of that first multidisciplinary visit to get a handle on some symptom management issues, answer some questions for the patients, as well as allay some of the patient's fears about the many different aspects of care that can be very confusing in that very intense first visit. This has already been piloted within our group and we're already learning a lot, and patients are already benefiting from this. So very early on, just communicating with our peers has given us an idea of how we can begin learning right now to improve our patients' journeys right from the very beginning. Canopy has the potential to accelerate scientific progress through this unique collaboration. Clearly, from a symptom management point of view, I believe that there is a lot of innovation and research that can be done in that space. But ultimately, I do think that this network will enhance more traditional clinical trials-based research as well as translational research. This is because I believe that we will establish common best practices regarding clinical trial enrollment, as well as databasing, biospecimen collections that will enhance our scientists' ability to interrogate what is working and what is not working in patients being treated. Ultimately, all of us want to leave the field of pancreatic cancer research in a better place than we found it. And I think through this collaboration and streamlining some of the methodologies that we have patients participating in research can really enhance and accelerate scientific progress. When we started working with the Learning Network, one thing that I was really struck by is the team spirit and the collaborative feel from the other institutions. I think really all of us are here to try to make this a better experience for the patients, and we all come to this with an open mind, recognizing that we all have our own strengths and weaknesses. And I think having a community to share some of the struggles that we all have, as well as some of the opportunities to learn, has really been a wonderful experience for our entire group. Pancreatic cancer treatment has been stagnant for decades. However, in the last decade, there has been a great amount of progress in pancreatic cancer with new chemotherapy regimens, new radiation regimens, and more patients being offered potentially curative operations. This is leading to a greater group of patients who are surviving this awful and deadly disease. That was the first step to try to improve upon the potential curability of pancreatic cancer. And of course, that remains a significant goal of all of us who dedicate our careers to taking care of pancreatic cancer patients. But what this increased survival and this increased need for multidisciplinary care has really brought to bear is a greater need to pay attention to what the patient experiences. And how do we do this? And how do we make this experience for the patient as smooth and as good as it possibly can be, given the very difficult situation that they're facing? Now that we have some ideas on how do we improve the cure rate and the survivability of pancreatic cancer, we need now to pay equally as much attention to the patient's quality of life, their symptom burden, as well as their caregivers' needs as well. We now are in the position where we can pay attention to the whole patient as we've learned some more improved ways of taking care of the cancer itself and really put the patient at the front and center of pancreatic cancer care.